My name is Kennedy Romick, and I am a fifth-year bioinformatics student. I am very excited to share the work that I did while in Uganda this summer. My project is the 10-year retention of volunteer community health workers in rural Uganda. The World Health Organization has identified improving maternal, newborn, and child health and survival as a global priority. In low to middle income countries, community health worker programs have been shown to improve MNCH outcomes. Community health workers are known locally in Uganda as VHTs, and between 2012 and 2014, over 2,000 volunteer VHTs were recruited from all villages in Busheni and Rubirizi. So what challenges are we still facing if these programs have been identified as effective in improving health outcomes and have already been implemented in low to middle income countries? Community health worker retention is low, and this is a big barrier when it comes to program implementation and scale up, specifically in volunteer community health workers. The solution: look at what factors are affecting community health worker retention and use this information to better inform future programs and policies. A 5-year retention study was done by Healthy Child Uganda, where they looked at demographic characteristics, retention rates, and exit reasons. This is where my project comes in. I worked with the Healthy Child Uganda team to update existing databases and then performed a retrospective analysis at the 10-year mark. The significance of doing a 10-year retention study is twofold. Firstly, there is a gap in the literature when looking at the long-term retention of community health workers and at community health workers in Africa, as most studies look at programs in Asia. Secondly, much of the literature states that the biggest factor for retention is compensation. However, providing compensation is often not an option. This is why we need to look at those who are volunteers. I conducted a retrospective review of 2 existing population-based databases, which consist of all initial VHTs, which are those who completed the initial Mama Toto training workshops in 2012 or 2013. The analysis of the retention of these VHTs includes looking at demographic characteristics, classifying reported exit reasons, visualizing retention over 10 years, and a Kaplan-Meier estimate of 10-year retention. Table 1 summarizes the initial cohort demographic characteristics. Most of them were female and had completed primary education or higher. The mean age was 38.8 years, and all community types were represented. After 10 years, 67% of community health workers remained active in their role. Figure 1 displays the full sample as well as both districts. Even though there is a difference in the population and income of the districts, the retention rates between Busheni and Rubirizi were similar at 69 and 62% respectively. Figure 2 displays retention rates for the full sample as well as males and females. Females had a 10-year retention rate of 72%, whereas the retention rate of males is only 57%. This suggests that males are more likely to exit than females. The estimated probability of retention at 10 years was 67.4% based on a Kaplan-Meier estimate, which is very close to the actual retention of 67%. Lastly, we have the reported exit reasons. Exit reasons were mainly deemed unrelated to the role, or in other words, were logistical. Only 28% of exit cases were deemed to be role-related. This is positive as it suggests that it is not the work itself that is a challenge to retaining community health workers. The conclusion of my analysis is that, while there are many key differences between Busheni and Rubirizi, they had similar retention rates. Females had a higher retention rate than males, and exit reasons were deemed mainly unrelated to the community health worker role. This work highlights the potential for scaling up of volunteer community health worker programming and for that programming to be sustainable. And this work can be used to better inform future program design, specifically regarding how community health workers are selected and replaced. My biggest takeaway from working on this project is the importance of sustainability. Retention is important because it is directly related to sustainability of these programs. Furthermore, to achieve sustainability, you need to consider the context of where you are implementing each project. And finally, I would like to acknowledge the amazing teams at both the University of Calgary Indigenous Local and Global Health Office, as well as the Healthy Child Uganda team, both of which who supported me and my work while in Uganda and once I returned to Calgary. Thank you.